Good evening, everyone again. My name is Susan, and I'm joining you in support of George Mason. And again, here along with Dr. Sheingold, who is the division director, and Dr. Uriyo, the MHA program coordinator, to talk about this wonderful CAHMME-accredited MHA program. So thank you for joining us. And Dr. Uriyo.
Thank you so much for the introduction.
Of course.
I am the MHA program coordinator. I've been in the program this is my 4th year, and I was previously overseeing the online program, and now I'm overseeing the the graduate traditional program as well. By background, I have experience working at Johns Hopkins Healthcare in their managed care organization and working with NCQ accreditation of their health plan. I'll stop there and I'll let Dr. Sheingold introduce herself.
Oh, thank you. So I've been at George Mason since December of 2018. My background is as a nurse with 20 years of trauma care experience before I went into academics. I teach the leadership and organizational change classes and also the capstone class that you take at the end of the course. I work very closely with Dr. Uriyo, and we function as a team. I also support the undergraduate faculty in the Bachelor's of Administration.
Yes.
Wonderful. Thank you. All right. So throughout this presentation, we're going to talk about the learning outcomes, curriculum details, the capstone, and outside of the classroom and various career opportunities. And then I can just discuss the admissions requirements. I am an admissions representative, so I can assist you with all those questions. And then Q&A can take place throughout the session or at the end as well. Y'all should be familiar with these. Raise your hand and questions. Just post your questions in the questions feature. And y'all have introduced yourselves. Those are your official titles. And go ahead, Dr. Uriyo.
Yes. So what makes our program unique? You're already here, you've already done your research, and you probably know the answer. But we are CAHMME accredited, and we are ranked 32nd in the nation. We have received, as of 2023, a CAHMME Canon Award for being a program that focuses on sustainability in healthcare, management, education, and practice. Our program is very flexible in that we offer our classes in the evening for those of you who work, so that is very flexible in that regard. And also some of the courses are asynchronous, so they can take place at your own chosen time. However, we do engage you and put in synchronous sessions so that we can have time to interact with you and answer your questions, because sometimes it is easier to talk rather than sending emails. However, whatever works for you, our programs will be more than able to meet your style of learning. And we also cater to providing you opportunities to do activities outside the classroom. We'll talk more as we move forward. Next
Wonderful.
slide. Yeah. So when it comes to the learning outcomes, as I said, we are CAHMME accredited, and so we focus on the domains of practice or domains of competency that we want you to get by the time you finish. So we look at the knowledge that you obtain, more knowledge of the healthcare system and healthcare management, that you work on communication and interpersonal effectiveness, because without that, nothing advances really. We look at critical thinking and analysis and problem solving. All your classes, you have projects to do, challenges that you have to overcome, and of course, teamwork as well. In addition, we offer you classes and opportunities to sharpen your management and leadership skills. Dr. Sheingold teaches the leadership class, and she can talk a little bit about that. And then we look at professionalism and ethics. I will let Dr. Sheingold talk about the leadership.
Yeah.
Yeah.
But in the leadership class, one of the first things we do is a strength finders assessment. So, and we do a lot of exercises around that throughout the semester because it's a team-based course. It's a case analysis-based course. And we also bring in a micro-credential for that class. And it's a micro-credential you don't have to pay for. So it's built in as an assignment on resilience. So that's provided through the university and supported by the university. It's, you know, when you take a look at some of these micro credentials, they're over $2,000 to get one, and we build it into this class. So that's a huge plus in the leadership class. Everybody, it's monitored externally by the university so that it meets a very high quality standard to achieve that during the course of the leadership class. And then our ethics classes are built in, ethics, the learning outcomes are built into the law classes, and those are taught by experienced healthcare attorneys that so you really get a top drawer experience in all 5 of these areas by the time you graduate.
Wonderful. Next slide.
Yes, please. Okay, so these are the list of classes that we have in our program. In total, everything adds up to about 45 credits. You have classes on the right that are required. The first one is GCH 500, Foundations of Public Health. We are in the College of Public Health, and this class provides you the opportunity to mingle and meet other students who are in social work, for example, who are in nutrition, who are in nursing. So the GCH 500 is a class that is required for all incoming new graduate students in the college. So another way of interacting outside the discipline. And then, of course, you have your statistics, the leadership class that Dr. Sheingold talked about. You get to learn about the role of government in healthcare, which is critical for you to know. And then quality improvement and economics. So you may come from we have students from a diverse background, but by the time they go through our program, by the time they finish, they are more than able to go work as an administrator in a healthcare organization, because we take you through various aspects of what is the healthcare system and what things should you be familiar with. I would like Dr. Sheingold talk about the concentrations, the quality, healthcare quality, and executive.
Yeah. This is our newest concentration. We did this in response to market research that these are the skills the market's looking for right now, especially with the movement towards value-based purchasing for insurance policies. And we have a pretty heavy interest in it. These are unique. They were co-developed with NCQA, the National Committee on Quality Assurance. So we have field experts as well as the academic expertise, blended into these classes. So they're very unique to our program. So we're about ready, after this semester is over, we're about ready to apply for a separate CAHMME accreditation for this, for the quality concentration. So it'll be double accredited. So it's very high, again, very high standard for our program.
Yes,
That's
thank you.
amazing.
And yeah, before you go forward, you move to the next slide. We have a 790 capstone class. So everyone who takes our program is required to take the 790 class. And you actually, maybe it's on the next slide.
Yep, it is on the next slide.
Yeah.
You got it.
Yeah. So you're actually going to be working working or interning or providing your expertise, your availability to an actual organization to work on an actual real life project or problem that they have within a 6-week, 8-week period, and leave that organization with a solution or at a point where that somebody else can take the project to the next phase. So we do support you in finding an entity where you can do this project at. And at the same time, we have students who actually do the capstone project within the employer. But not in the same department, but outside your current department. And you find a preceptor. We have requirements that the preceptors need to have. But for the 4 years I've been here, every student has successfully completed their project. Nobody has not been able to complete. So it is a doable ask that we have for you. And I think you'll find it very useful. And our preceptors also look out for our students as well. Dr. Sheingold, do you want to add anything?
I do. I have an example I can provide, but I also want to add that Dr. Uriyo and I are both certified project managers. So we bring that to the table with this particular class as well. One project that just came to mind in listening to Dr. Uriyo was from a student in North Carolina, for example, who worked with the public health department in her county in North Carolina, because there were a lot of people swimming in the, because they were raised that way, to swim in the creeks and swim in the tributaries in North Carolina that had a lot of algae blooms in it in this day and age, and did a public service project and actually did a radio commercial. That was her project. She did a radio commercial warning people not to just jump off the docks at the end of their piers anymore, to what to look for if the algae blooms were very active in terms of the sheen of the water, and the dangers that could happen by taking for granted that you could just swim anywhere like you grew up, because it's changed and they need to be aware of what algae blooms can do. So she did a whole strategic plan for the county to launch this advertising campaign to educate the public. And and it ended up being broadcast on the radio. So that's just one example.
Yeah.
That's really cool.
Mhm.
Next slide.
Yes, please. Yes. So aside from classwork and homework, we do provide you additional opportunities to network and to expand the skill set of you being in healthcare. So we have an organization called Rising Healthcare Leaders of Mason, RHLM. I'll let Dr. Sheingold talk about that. But the next one is we also have within this region, we are part of the National Capital Healthcare Executives, which is a regional chapter of ACHE. You will know more about that once you join the program. Also, we are members of UPD Honor Society, as well as Academy Health Student Chapter. We have that internally in the department, and you can become a member of that and take part in whatever this chapter does. We also have series related to health policy seminars, and yes, national competitions. Dr. Sheingold can talk about both of them, RHLM and the case competitions.
Okay.
Yeah.
So I'll start with the Student Association, RHLM. We're very different from other programs in that we include online students in every single way that we can. The officers for RHLM are made up of on-campus students and online students. The online students network to make sure that the online students are included. The online officer networks to do that. But we also, when I say we, Dr. Uriyo and I have oversight of that as well. And we make sure that we don't do anything without including online students. We have a huge event tomorrow night with executives coming in from Innova Health System, which is our big health system in Northern Virginia. And they're coming in to do a panel discussion, which will be broadcast live nationally, and followed by a demonstration of a behavioral interview to get students ready for interviews, because that's the mode that they're conducted in nowadays. And then they're going to do a speed networking session at moving from table to table with different executives to ask questions from each executive. So we have a laptop set up to take live questions from the audience from all over the country. And this is all sponsored and driven by our students. For case competitions, I just actually had a meeting right before this one to tee up a team for a virtual case competition at Penn State. These are competitions that are national with other schools, other MHA programs. And we have a dedicated coach that's a faculty member to do that. Depending on the competition, different coaches are assigned. I just came back from one in Florida with the National Association for Health Service Executives. It's the biggest one in the country, and we pay for everything for a student to go. We've taken virtual students to these competitions as well and paid for them to fly in from whatever state they live in. We had one recently that flew in from West Virginia and participated in a competition that was at University of Alabama, which is another big national case competition. So at every opportunity we have, we share with you. And we also fund all of this to make sure that we are as inclusive as possible. And I think that sets us apart from other online programs. We follow the data, we track the market, and we know that other programs don't do these outside activities and provide the opportunities that we do. So I think that really speaks highly of George Mason. We roll up our sleeves and put a lot of effort into it.
That's amazing. I mean, for an online program, you are definitely going to get to be able to network, and that's so very important. Terrific. All right, on to job opportunities.
Yes. So when it comes to what can you do or what should you expect from this degree? One of the things is you can work in managed care. If you, for example, take the quality concentration, you can use that very easily in managed care. You can also use it in long-term care management because quality is number one. Quality and patient safety management. So anything, I guess, performance related, risk management related, that push the issue with value-based purchasing, you can do that. With the executive route, that opens a wider opportunity for you in the various departments that make up a healthcare entity, whether it is in finance, whether it is in operations, whether it is in care management. You as the administrator have an opportunity to be at the table to guide and manage that organization or that group. Dr. Sheingold, do you have anything you want to add?
That was so well said, Dr. Uriyo. It's a tough act to follow, but I will add that we do have a 93% placement in the field of choice within 3 months after graduation. And that's a pretty high statistic. We track that carefully, and we're required to track it to be, CAHMME accredited, because they expect us to have those kinds of outcomes. So they watch us. And we know for a fact that that we do what we say we're going to do. So something to keep in mind as you look at programs, and I know you're all looking at other programs and making a tough choice, and we want to be your program of choice. You're going to spend 2 years getting a graduate degree. We want you to be happy. We want it to be a good fit. And we want you to know that we're here for you. We're student-centered.
Yes.
That's terrific. Okay. All right. Now, y'all been really shy. Go ahead and post your questions because you have the people that can answer them. I deal with the admissions process. So if you haven't already spoken to someone in the admissions office, feel free to reach out to us. I will go ahead and post actually it's on the next slide, the information to reach out to us. But the application process is very easy. If you have unofficial transcripts, admissions can use those to confer a decision. And in fact, Mason will attempt to order official transcripts on your behalf as a courtesy. As mentioned, this is an incredible program. It's CAHMME accredited. you know, and by virtue of us being close to Capitol Hill, we, on the prior slide, there is opportunities to have the Zoom sessions with congressional policymakers, which I think is really cool too. Back to the admissions process, a resume, y'all typically have that, a statement of purpose. With respect to letters of reference, we also make that very easy as well. You need 2 professional references. One needs to be from a past or present supervisor. And all you do is input their names and emails into the application portal. Once you do so, they automatically receive an email that will take them to a questionnaire. Literally takes them 10 minutes to do. Now, one really cool thing about this program is we have a short video interview, and have no fear, it's just with an admissions representative like me. If I'm your admissions representative, we send you the questions in advance, and basically it's, you know, tell us a little bit about yourself, why you want to get the degree, what are your career goals, you know, why Mason. And it usually takes 5 to 10 minutes, and then we send it up to admissions. But again, the process is very easy. We have 3 start dates. Currently, you can apply for spring, which is January. Then we have a summer start, and we then have a fall start. So, do y'all have questions?
I see it.
Okay.
I
Yeah.
see some in the chat here.
Oh, I like that. Okay.
Yeah. Do you want me
Talia,
to take this first one about the capstone project, Dr. Uriyo? This one down here from Gabe.
You want to take it or yeah, go ahead.
Where are you from, Gabe? I'm looking through scrolling through these chats here. Where are you?
New Jersey.
Oh, New
Jersey in the
Jersey.
house.
Okay, so the answer to your question is yes and no. Yes, you can complete it where you work, but no, you can't complete it in your current role. So I'll explain that. It has to be a different a different supervisor for your capstone project, a different preceptor than who you directly report to. So many people complete it in their organization, but not in their own department with their own boss. So that's where it bifurcates. So we meet with every student and every preceptor to make sure that it's not your boss that you're reporting to as your preceptor. And it is also an opportunity to step out of your comfort zone a little bit and do something different. So I hope that answers your question about the duality of being in your current role, but also being at your workplace. Let me know.
Now, is this something that you can put on your resume?
Yes, a lot of people do put it on their resume. We want them to put it on their resume, and the preceptors can often write letters of reference based on the student's work and their experience with the students. So it's helpful in that way as well.
And you said that if you're not working in the field, you'll help them find placement. Is that correct?
Yes, so by the time they reach, it will be like 2 years. By the time they get to the capstone, they would have been making those network connections because for example, we have a symposium every year where we bring in people from the healthcare sector, C-suite executives, and also guest speakers within the classes that our students take. So by that time, not that we do help our students make sure that they finish and find the connection that they need to do a project that suits where they want their career to go. So we do help them in that regard, yes.
And you said that everybody's been successful in completing that, so that's fantastic. Okay, there's one before Gabe. Talia says, what does a typical class look like in terms of work experience, background, etc.?
That's an interesting question because everybody, let's say, okay, so you've never been in healthcare before, you're taking your first class, all our classes are 6 weeks in duration, right? No, 8 weeks in duration.
Mhm.
And so assignments or modules are weekly. And so it can be read something or write a paper or watch the faculty's video about a certain topic. And in some classes, they will have a synchronous session in case you have a question. The professor will be there like an office hour. You come in, ask your question, and you can leave. That is not all classes have that, but some do, especially the technical ones. And then so it's more of like an independently driven learning, because at this stage you have to be independently motivated to learn and do the work, because you are making that decision right now to apply. So we are beginning to treat you like that executive. Yeah. But we have had success, and our students do succeed in finishing their requirement for each given class. So we don't leave you like it's a cold class here, like automatic, robotic, nothing. Yeah, there will be a faculty person on the other side. Yeah.
I like the fact that there's a combination of asynchronous and synchronous, though. I think that's really nice.
Yeah.
One question is do we enroll in a concentration following potential admission or in our initial application?
So I think you can choose which concentration you want as you come in. So I think by default, it will put you in executive unless you say you want to go into quality.
But you do your core courses first, right? So if you changed your mind, like if you selected one concentration, you do your core first and you could always change, correct?
Yeah.
Mhm.
Yeah. We're not going to lock you in
Sure.
one thing. Yeah.
Okay, so Isabel says, I'm sorry, go ahead.
I read that. I can take Isabel's question. And I apologize, Isabel, if we were confusing. We have one CAHMME certificate accreditation that covers the online and the on-campus pathway. The classes are identical. They're exactly the same. But if you're an online student coming in for admission with Susan, then you do not take any in-person classes. It is strictly online. So I apologize that I confused you about that. So they are asynchronous. And thank you for asking that.
Yep, good to clarify. Absolutely. Okay, any more questions?
Well,
I'm going to go to the next slide. That just has my contact information, and I work with a team of admissions representatives. So, if it's me or one of my colleagues, we're more than happy to help you. And again, it's very easy to complete the application.
so, okay. There's so many questions.
It's a good thing.
It's good, yeah. So if we don't answer all of them, we'll probably send you our answers. But yeah, the program is 24 months. It follows a pattern. So if you begin whichever time you begin, you will go through all the classes. So it does follow a pattern. But if you decide to stay out, but then that may affect your ability to finish it in a given time frame. So it is basically up to you as to how quickly you want to finish and how timely you want to finish. But life happens, and sometimes our students have to step back and then come back. Yeah.
So we do give up to 6 years to complete the degree,
Mhm.
but as I understand it, with the online, it's 15 courses for 45 credits. And then what you do is you take one class every 8 weeks.
Yes.
Semester is 16 weeks, so you're completing 2 classes a semester. So you can't double up and take more than 2 classes per semester. Is that correct?
That's correct.
Okay.
Mhm.
Okay. Yeah.
Mhm.
Khalil is asking a question. Mhm.
want me to answer that, Dr. Uriyo?
Yeah, go ahead.
Yeah, we stay on top of your competency mastery ever since you started the program. We start with a baseline that's unique to you, and then we measure it halfway through, and we measure it again at the end. We also have an executive in residence available to help advise and counsel you about how to improve a particular competency. It's measured, it's data that we can see, and it's not tied to an objective opinion like an essay in a class. It's actually multiple choice testing that we do that's designed by our faculty and supported by the faculty and our executive in residence, which is a very unique feature of the class. Of the program. Not all programs have an executive in residence to help support students with their competency mastery, but we do. We're one of the few in the country that have it. That's an excellent question.
Can I ask you a question? I've never heard of like micro competencies. So is that something, is that something you'd put on your resume or like, can you
Yeah,
speak to
a
that a little bit?
micro credential is
Oh,
something
credential, sorry.
that's okay. A micro credential is the same thing as a badge. You may be more familiar with it as a badge. And what it is a unique core of knowledge that you achieve, that you're tested on, that you're awarded this a special micro credential for, different than taking a whole certificate, say that's 15 credits. This is embedded into a class as an assignment that lasts 6 weeks in that particular class. So some students, and they're organic, these badges and these micro credentials are organic. You click on them just like the QR code, and it pops to all the things that were included and that you had to learn for this micro credential. Now, some students will take those and put them down the left-hand margin of their cover letters for jobs. So employers can just click, 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 click on what they have and see immediately what their skill set is. With a one-page cover letter, you want something unique that's going to catch the eye of an employer. So that's one way to use it, but it really defines specifically unique skills outside of what we offer in the program. And for the resiliency one, it's free of charge. We're developing another one in leadership now, another one in emergency management, because we know the market wants them. We know the students want them. So we're meeting that need, and we're developing new ones right now, and we'll be presenting it to the board tomorrow.
That's really cool.
Yeah, thank you. So there's this thing about work experience is not required like most other programs. We do not make it that it's a requirement that you have to have work experience in healthcare. It's good if you do because it will help you. However, the program takes you from the beginning till the end. So don't let the fact that you don't have healthcare experience be a limiting issue for you. So
Amy has a question about national nursing conferences.
We don't network at national nursing conferences that I know of. That George Mason University does. As a university, they'll network because we're a college of public health, and they present the whole slate, the whole portfolio of programs that we offer. But we don't, just as our MHA program, network at nursing conferences. We do have a lot of nurses in the program, and we've had 2 nurses just recently in our capstone course, and they both have won awards. Both of them won awards for their projects, and one is getting ready to publish her project now in the Journal of School Public Health. So,
wow.
Yeah,
So
work with them.
Speaking of public health, Mason is the only college of public health in the state of Virginia. So that's another thing that sets us apart too. Any other questions?
I see a question in the Q&A here from Talia about fellowships. Do you see those ones? My institution.
There it is. Yeah.
my institution offers a fellowship, paid administrator's fellowship. Do you find these opportunities helpful? If your institution offers it and it's open to you, for sure, I'd apply. We do have students who have applied to administrative fellowships, and it's good if you have them, if you get them, because they're so few in number. The demand for them is very high. Dr. Sheingold actually, Dr. Sheingold writes all the recommendation letters for all the fellowships. So I'll let her speak about them.
Yeah, they're very competitive. They usually only take 2. That's why they're so hard to get. Like Dr. Uriyo said, they don't take a very big number per organization of fellowships. But we just had a student who had one at Mayo Clinic, very prestigious. She just completed that this summer. And so we do have students that get into fellowships, but they're hard to get into. And it's also not required for our program to have a fellowship. A lot of MHA programs still require those, and they tend to be 3-year MHAs because a year is taken up with your fellowship. So we support our students to do it after they graduate. Most of the applications go into NAFCIS, if you're familiar with that. And we've probably sent out 50 solicitations for different fellowships just
Mhm.
this season alone, which starts in June and runs through September. So we're very active in terms of providing the information and writing the letters. I can tell you, I write a lot of letters.
Yes. Mm.
Stephanie wants to know, how much time have previous students reported dedicating to the coursework each week? That's a great question.
It is a good question.
I think to do a good job in a given class, if you can spend like 6 to 10 hours, 6 to 10 hours a week is good. That's like an hour a day, you know,
That's not bad at all.
good. But it depends how deep and how dedicated you want to be. It's all up to you to do a good job. Dr. Sheingold, do you have any thoughts?
I think there's certain classes that you'll find you need to spend more time in than others. The law class, for example, is not a lightweight class, and the professors that teach that run it like a law school. So you're not going to want to go into that class unprepared in any way, nor any class unprepared, but particularly that one. So that's something that you should keep in mind. Not all classes are created equal, just like any other program, and some are harder than others and are going to take more time. And then I see a question here from Tony about getting the MHA, and I would say it depends on the direction you want to go in with your career in social work. If you want to go into more of an administrative operations role with mental health and addiction, then it absolutely makes sense. We have a graduate professional assistant right now in our MAP clinic who is working, and they do a lot of addiction and mental health care. And she's working on all their scheduling and working on the operations end of it, not in the clinical practice arena, but supporting the clinical practice, which is what a MHA is designed to do. So I would say it depends on your career goals.
Mhm.
So there's this question about the cost.
Yeah, I can handle that. So let me get my information. Whoops. So I do believe it's $8.95 per credit. So when you take into consideration the distance learning fees, the total for your investment for the entire program currently stands at $43,770. And so again, this is spread out over the 45 credits. Okay, it's 15 courses. They're each 3 credits each. Okay, yeah.
Yeah.
And there was one I don't think that we spoke about. Khalil is asking, what if any seminars or additional webinars are needed related to coursework before you start classes. Um, you have career changers, right? I mean, so you don't necessarily
Yeah.
have to have
Mhm.
any specific coursework related to this. You've had successful career changers. Um,
Yes.
However, I would say it is a competitive program. The GPA is important, right? So you're looking for a minimum of a 3.0 GPA.
Mhm.
Um,
Mhm.
but y'all take into consideration, you balance the whole person, like if they just graduated versus if they have 20 years of work experience. Would that be correct?
Yeah,
Yes.
they're very holistic admissions, and we
Mhm.
look at the entire person and what
Right.
they bring to the table. Those purpose statements are very important, so that we read all of those and
Hmm.
we consider the entire person in a holistic way.
Yeah.
Yeah. And we have, like, say, for example, we do have the option, there's a GPA addendum that you can explain where you were at when you were going through your undergraduate and how you're going to be successful in the program. The application fee, Stephanie, is $75. Okay. And yeah.
They're
Okay.
asking, is there a difference between state and out of state tuition? I don't think there is.
No, there's not. So when you're online, if you live 5 minutes away or across the country, it's a great thing because there's a lot of people in Maryland. It doesn't matter. It's online, you know. Um, and the one thing due to is it CAHMME, due to the CAHMME accreditation, you cannot complete this degree overseas,
Mhm.
correct?
Mhm.
Yes.
Right, right.
Mhm.
Okay, all right. Anything else? Oh, we have two in the chat. Oh, yep, we just answered that. Okay. Well, this sounds like such a well-rounded program. The fact that there's so many speakers. How many Zoom sessions are there with the congressional policymakers, healthcare policymakers?
They usually plan those in the summer, and they usually have 3. Uh, I haven't seen more than 3. But that's usually what they have. But I mean, in the healthcare policy classes, there's speakers, and then we bring in other speakers throughout it just depends on who's available and what the event is. But for that speaker series you're talking about, it's usually 3 high-level policymakers that they bring in.
That's wonderful.
Yeah, because we're as a health administration and policy, so we have a lot of policy faculty embedded in our faculty bench.
Excellent. Anything else? Hmm.
And I'll say, like everybody else, our program is uh, looking at AI and the implications of it. So surely, as you consider coming to Mason, know that you will learn about AI and how you can use it in healthcare. So,
Oh, wow, that's fantastic. Yeah.
mhm.
So y'all have a statistics course that's in there. And, there's lots of people that are really scared of math. And if they've never had math before, there is a LinkedIn Learning Statistics. Would
Yes.
that be something beneficial? I know it's like free for 30 days and takes, I don't know, like 5 hours to complete the modules. Would you suggest that as something to encourage people to do, or what are your thoughts?
I would encourage them, yes, to do it, but I would not let that alone be a barrier to applying and
Yeah.
even embarking on taking statistics, because
Gotcha.
we have tutors and,
Mhm.
everything with determination and support and guidance you can overcome. So, yeah, so,
So
yeah.
I would just say something maybe as to make them feel more confident when they take the course. Would that
Mhm.
be if they want to?
If
Uh,
they want to, for sure,
yeah,
because Coach Mason also, is when you come into Mason, you do get access to that LinkedIn Learning. It's available to you as a student. Yeah.
Oh, wow.
completely. Yes.
Oh,
Yeah.
fantastic.
Yeah.
Okay.
Yeah. So
Well,
yeah,
wonderful.
you can be studying and getting all these different certificates on the side too.
I love those badges. I'd be
Yes.
like,
Yeah.
sign me up. And I've got to say, healthcare is not going anywhere. And unfortunately, the population is aging. So you
Yeah.
guys are going into the right field.
Yeah.
Definitely. Yeah. And
Yeah.
also, speaking of AI, Mason is a tier 1 research university. We are the largest research institution in Virginia. So that means your curriculum is going to be backed by the latest, research-based evidence. So that's fantastic.
Mhm. Mhm.
Okie dokie. So, any more questions? Now is the time. Is there anything else that y'all would like to add, Dr. Sheingold or Dr. Uriyo?
I would just encourage them to apply.
Mhm.
Yes.
Absolutely.
Mhm.
Absolutely.
Yeah.
And, as an admissions representative, I always explain to the applicant that I'm not going to be looking at your applicant, because sometimes they try to sell themselves to me and I'm like, oh, I'm not going to be looking at your application. But, we are sort of we see the gatekeepers is the word I
Mhm.
was looking for. So we see what makes a good candidate and what doesn't. So
Mhm.
I've got a question. So say if somebody was really like, this is something I really want to do, maybe a recent graduate, not the greatest, whatever, and GPA, would you,
Mhm.
there's always the possibility of taking some non-degree seeking graduate level MHA courses to boost their GPA, right? And then maybe apply.
Yeah, there's two answers for that.
Okay.
One, depending on the GPA, we can admit provisionally, which gives
Ooh,
a semester opportunity to raise your GPA to a 3.0 with, there's guardrails around that to make sure that that's accomplished, or you're not admitted. You're not really admitted until you meet that requirement. The other way is to do what you suggested and take non-degree classes to raise your GPA and then apply, so that you're not throwing away any application fees or you're wasting your time applying, but we'll guide you to take the classes that you need for the MHA, but you take it as a non-degree to help raise your GPA, and then everything transfers in because you've already taken it at George Mason towards your MHA. And there's some of the best students we have. So
Mhm.
it's something to keep in mind.
Mhm.
now for somebody who is out of state, we have some New Jersey people here. So if it's so with the online program, you have to be in the program as a whole. It's not like you can take a couple courses here and there. So for people like that, if you can't come to campus to take some graduate level courses, we do accept transfer credits, right? I think it's like up to 12. The only caveat to that is would it have to be from a CAHMME accredited institution in order to transfer and be closely aligned with the curriculum?
Um, I'm not sure about that.
I'm not sure about the CAHMME accreditation piece of that question, but it
Okay.
doesn't have to align, or we can't accept it. We compare the syllabi, we compare the outcomes and the deliverables for classes, and then we make a decision on a case by case basis. If
Okay.
they're
Mhm. Yeah.
Gotcha.
Yeah.
Okay.
Yeah.
Sounds good.
And even if they've taken like a master's degree from, not a master, a graduate level class, let's say in statistics in another university, uh, and they've decided to switch gears and they want to come into the MHA, we'll look at their statistics class and compare it to our statistics class, for example. Yeah.
Excellent.
Mm-hmm.
So Loretta's asking, do you waive the application fees for disabled veterans and their spouses? I wish we did. I don't believe we do.
I can't answer that question. That's probably a college.
That's a student
admission.
affairs question
Mhm,
from
Yeah,
our Dean of Student Affairs.
yeah.
mhm.
I can
But
tell
it's
you.
always I always say you can always ask. There's nothing wrong in asking, calling the number and asking. Yeah. Mhm,
Absolutely. And I agree with that. Mason is a yellow ribbon school, so we do have a separate office that handles all of our military applicants or military dependents. So if you plan on using military benefits, we can direct you to specific people with their names and numbers within that office that can assist you with what you'd be, eligible for. But, you know, regarding the student application waiver for the veterans. So student affairs, that's good to know. So
Yeah.
yeah, excellent.
We have a lot of Navy personnel in our program.
Really?
Yeah, we do.
That's
A lot
interesting.
of Navy.
Now, in terms of the demographics of the students, it varies, doesn't it? Like some of them are new grads, some of them have been in the field for a while, right? Would you
mhm.
say? Yeah,
Yes, it varies. We have people across the spectrum in terms of age, from like 20s to 30s, 40s, and even approaching 60.
Yep.
So, there's like there's no end to learning, lifelong learners. So
that's
that's
right.
it's always good to do that and be like that. Yeah.
Hmm.
Mhm. Okay.
Okie doke. Well, thank you again for
You're
spending
welcome.
your evening with us and sharing all the great information about this program. It really is an awesome program. Dr. Uriyo, thank you.
You're welcome.
Okay,
Mhm.
so we'll go ahead and end it.
All right. Have a good day.
It was nice
Good
seeing you.
evening,
Take
everybody.
care. Thank you for
Bye-bye.
joining us, everyone. Take
Bye-bye.
care.